Mr. Kabila, can you hear us?
And you are very welcome to this press briefing of the Africa CDC. This is the opportunity when Dr. John, the director of the institution, gives us a breakdown of the continental situation with regards to COVID-19 and the COVID-19 pandemic, but he also gives us the latest updates on developments relating to vaccinations and other issues that concern that pandemic. My microphone was off there. I was just welcoming everybody to this press briefing, which is brought to you by the Africa CDC. And with me, as usual, is the director of the Africa CDC, Dr. John Nkengasong. He's going to be giving us the breakdown of the situation of COVID-19 on the continent, but he will also go into issues of some of the pledges that we've heard about in the media that have come through from the summit of the G7. So he will try and give us some details as far as he knows of how that process is going to unfold. My name is Wayne Musabayana. I'm head of communication at the African Union Commission, and it is now my pleasure to hand over to Dr. John Nkengasong, the director of the Africa CDC. Dr. John, you have the floor.
Thank you. Thank you, Wayne, and good morning to everybody, and welcome to this weekly briefing. At this time, I will share updates on the COVID-19 situation on the continent, including our response efforts and updates on vaccination situation. As of today, June the 17th, African Union member states have reported over 5 million COVID cases across 55 member states. And this represents 2.9% of the total cases globally. A total of 138,000 deaths have occurred since this pandemic started in Africa, and that represents a case fatality rate of 2.7%. 5 countries are contributing 62% of all cases. That is South Africa, 35%, Morocco, 10%, Tunisia, 7%, Egypt, 7%, Egypt, 5%, I beg your pardon, and Ethiopia, 5%. In terms of variants, 30 countries have now reported the Alpha variant, which we used to call B117. And since the last briefing, 2 other countries, that is Djibouti and Somalia, have now reported this variant. 29 other countries have reported the Beta variant, which used to be called the B1351 variant. And 1 additional country, Djibouti, has now reported that variant. 13 countries are now reporting the Delta variant, which we have all called the B1617 variant. And 1 additional country, Malawi, added to the list of countries that have now reported that variant. Over the last week, since we met, that is between the 7th and 13th of June, if we compare that last week and this week, we have the following observations. 122,000 new cases of COVID-19 have been reported across the continent, and that represents a 29% average increase from the previous week. The highest proportion of new cases are from Southern African region, with 61%, followed by North Africa, 21%, East Africa, 14%, Central Africa, 2%, and West Africa, 2%. At this point, let me say that several countries are now moving aggressively towards the 3rd wave. And 15 of the 55 member states are now in their 3rd wave of the COVID-19 pandemic. 1 country, Tunisia, is now in the 4th wave. So we will continue to see these waves come in and go until we complete our vaccination program. That is what makes this pandemic extremely challenging and difficult to fight. If we now look at the last 4 weeks, and we have the following observations. So this is the period ranging between May 17 and June 13. In terms of new cases, we have observed 22% average increase in new cases over the last 4 weeks. And by region, the breakdown is as follows. About 122% increase in Central Africa, 34% increase in Southern Africa, 13% increase in East Africa, 10% increase in North Africa, and 3% decrease in West Africa. In terms of deaths, we've observed an average of 7% decrease in new deaths each week over the last 4 weeks. Let me now transition to testing. As of today, the continent has conducted about 50 million tests. Over 1 million tests were conducted last week. That is the week 23rd, the epidemiological week 23rd. And this represents a 10% increase compared to the previous week, which is very encouraging. Our positivity rate remains at 10%, with a test per case ratio of 9.9. 8 countries are reporting test positivity rates higher than 10%. That is Angola, DRC, Egypt, Namibia, South Africa, Tunisia, Uganda, and Zambia. Last week, the Africa CDC supported the training of over 600 healthcare workers in 40 AU member states in the areas of infection prevention control and how to manage continue to manage the pandemic. These trainings are being conducted in both English and French. We supported Cameroon with trainings of 30 clinicians on case management of COVID-19. And let me transition now to the vaccine and vaccination situation on our continent. As we announced last week with all of you, a partnership with the MasterCard Foundation has enabled us to commit up to $1.3 billion in an initiative we're calling Saving Lives and Saving Livelihoods. And it will enable us to procure 50 million vaccines to be able to immunize 50 million people across the continent and also support delivery. So what have we done since last week, the announcement was made? We have now engaged 4 out of the 5 AU regions, that is Southern Africa, Eastern Africa, Central Africa, and Northern Africa. Next week, we will be engaging with the West Africa region, and that will be the last regional engagement processes, which are targeting ministers of health so that they can understand exactly what this initiative is about. And then we are requesting them to submit us their work plans so that we can start immediately supporting them. So I think that by the end of next week, we'll have a good sense of who needs what in each of these regions. So with respect to where we are today with the vaccination process, a total of 59.9 million COVID vaccine doses have been procured by 51 member states. Of that number, 42.1 million vaccines have been administered, which represents 70% of the total average available in our stock. So of the 59 million, 42 million have actually been effectively administered, which is a pretty good number, about 70%. But if you look at the population coverage, 0.79% of the population has been fully vaccinated on the continent, 0.79%, which is an increase. We are making smaller progress here, an increase of 31% compared to the previous week. Let me just use at least 5 countries or so to highlight some of the distribution of the doses, how the doses administered versus the percentage supplied. Morocco, for example, has acquired 16 million, and they have used up 87.5% of their doses. Egypt, 3.5 million. The doses acquired, they've used up 50.7%. Nigeria, 2.6 million doses, they've used up to about 66%. Ethiopia, 1.95 million, they've used up 78% of that. And South Africa, 1.2 million, and they've used up about 61%. So we see progress. I mean, there's progress with some countries really making aggressive moves to in the right direction. A couple of countries are still have still not started the immunization program. Is Tanzania, Sahrawi Republic, Eritrea, and Burundi. Last week, Chad, if you recall, was in this category, but they started their vaccination program last week. As of June 9, Eswatini received 14,000 doses of the AstraZeneca vaccines from COVAX. And on June the 2nd, Burkina Faso started its COVID-19 vaccination with healthcare workers in that country. So let me end there just by saying that we all followed the G7 meeting last week, where there was a huge commitment of 1 billion doses of vaccines to be administered between now and next year. We welcome that news, but we also want to make sure that we put it in the context, the right context, that the 1 billion doses are not here now. We are hoping that they will be here soon. We also heard from the Biden and Harris administration that the United States is committing up to about 500 million doses of the Pfizer vaccines. We welcome that news, and we are already in discussions with the US administration to understand the distribution of those doses and timing. Yeah, so let me end it and so that we can discuss this a little bit further.
Thank you very much. That was Dr. John, the director of the Africa CDC. And colleagues, let me just remind you again of the means through which you can send in your questions to us. We still utilize that WhatsApp number, which is +251 9455 02310. +251 9455 02310. You can also use the live link up as well as the Q&A section on the Zoom platform. All right, so now let's move into our first question. I don't seem to have the news agency of this writer, but it is coming from somebody called James, and they say COVID restrictions and their impact on Africa. What is the impact of the ongoing restrictions on Africa, given the flow of people from Africa to the developed countries? And also, what can be done to mitigate the impact of these restrictions?
I think since this pandemic started, we have all faced severe restrictions, and the restrictions and have modified our way of life in a way that it's unprecedented. Now you have to think very hard before you start traveling, because you have to go in for that COVID test and then get it done, get the results ready to be presented at the airport. I think that has really modified our way of life significantly. And that will continue to be the case, I mean, going forward. And again, as I've cautioned here, when the developed world will finish the immunization programs, I have no doubt that there will even be further restrictions with respect to the imposition of COVID vaccine certificates. We at the Africa's Union have taken a common position that we cannot have that and kind of restrictions because it will create further inequities and create a further hardship, especially for those who have no access to the vaccines. We recognize that in future that will be an important requirement, but we have to have access to vaccines before we start imposing such restrictions. I think that is all I can say for now, but the restrictions are impacting everybody. I mean, impacting the economies, impacting our way of life, and impacting even the way we conduct a business in the workplace.
Thank you very much. We have a question coming through from Sarah Jerving, who's with DEVEX. And she says, can you elaborate on the specific reasons as to why the 4 countries have not started their vaccination campaigns?
I can only say that some of that, or most of that, will have to do with the leadership in the country. I think the vaccines, as you know, we have our platform, the African Vaccine Acquisition Task Team has, as we said, we've explained on this platform about 220 million doses of vaccines, Johnson & Johnson. It's open to all member states, and all member states, we're really actively encouraging them to access the platform. And some of the countries have been challenged with leadership issues, and we hope that as we continue to engage them, the situation will improve. But Sarah, I think mainly it's a leadership challenge. That's all I can think of.
Thank you very much. Let's go online and invite Paul Adepoju, who has his hand raised. Good morning, Paul. Hello, Paul. Hello, Paul Adepoju.
Hello, Paul Adepoju. Yes, thank you very much for the opportunity. So I have a question. When the first testing kits were first made available, Dr. John said by ensuring that by more countries using these testing kits, the level of confidence in them would increase, and the decision will now be decided whether their adoption and their usage can be expanded. So I'd like to know what is the current state of confidence in the testing kits, and have we gotten to the level where they can now gradually replace the PCR testing? Thank you very much.
I mean, Paul, let me be sure that I'm answering your question right. You mean confidence in the PCR test or the rapid antigen test?
The rapid antigen test.
Yeah, so I think that's a very good question. I think let me just start with the molecular test, which is the PCR test, which is the gold standard for testing. And we at Africa CDC have actually been working with countries to continue to support the quality assurance of that. We've conducted several trainings together with the African Society for Laboratory Medicine. So I think that is really not an issue. I mean, all tests have their limitations, and continuous quality improvement is critical to ensure that the accuracy of test results. The rapid antigen test, as I always maintain, is a game changer. We are working very closely with the WHO, and we at Africa CDC have actually procured and supported many countries to use the test. And we are encouraged to see that some are being used at airports. I've traveled across several airports in Africa, and you see that they are using it effectively. And we are also encouraging countries that they should use it actually to enhance their surveillance so that you can pick up hotspots early and squash them, because it's easy to do. If you, for example, take that test to a community like a school setting, and you say, well, every month or every 2 weeks, I'll do a rapid screening there, it can be extremely useful so that you can compare the rates of the positivity rate over time, and then you make a determination if you want to either shut down that location or do something else. But it's a very powerful tool that will help in enhance community surveillance there. So I think there's confidence that has been established that the tests are performing well and that they are being used extensively in most countries. But we encourage even more usage of the test because, again, as I said, it is easy to use, it is reliable, and it is easy to be distributed.
Thank you very much. I'm seeing that we have a hand rising from someone from the African Union, and that is Ambassador John Mfasoni. Ambassador, do you have a question that you want to pose to us? Ambassador Mfasoni? All right, I think we will move on. I'm still waiting for colleagues to send in more questions, but in the meantime, I could ask you some historical questions that we have. So there have been issues, especially now that the vaccination is underway, of whether an individual who has an underlying condition can get a vaccine. Will this exacerbate the underlying condition, or will it not really matter whether whether someone has an underlying condition or not?
It depends on what underlying conditions you're referring to, but we know that for especially those who have non-communicable diseases like hypertension, diabetes, and others, they've actually been encouraged to get this vaccination early because we know that those are risk factors for severe disease outcome. So when you have those underlying diseases, it is actually a good thing to get your doses, and so that you are properly protected. So we don't know of any scenarios where it will be that will call for people not to be vaccinated because they have certain underlying conditions.
All right, thank you. Another historical question that we have. If I've already had COVID-19, do I still need to get vaccinated, or am I okay?
No, you are not okay. You still have to be vaccinated because the immune response from these vaccines is more powerful than the natural immune responses. We also know that over time, between 5 months and 6 months, the antibodies begin to decay, and that doesn't offer you long-term protection. But we now know, again, keep in mind that We have perhaps not even closed a 1 year cycle of vaccination to relate from the vaccine, so that we truly don't know the longevity of this immunization. But if you look at studies like those from Pfizer, even after 6 months, the level of response was still very, very high. So I think it is really I highly encourage those who have been infected to actually get their vaccines. Studies have actually shown that if you're infected and you get your shot, your immune response is even better than someone who has never been infected, because you have been primed already by the natural virus. So if you get the vaccine now, it gets you even a stronger booster.
Thank you very much. Paul Adepoju has a follow-up question. And he says, will the Africa CDC be recommending that the rapid testing kits replace the PCR tests anytime soon?
Paul, that is a very good question. I think that discussion has started with consultations, and it will be, I think I will lean towards that direction, where, especially for our land borders. Okay, because we have done well with the airport movement, with the PCR test, but a lot of our land borders are challenged. And we see that a scenario where the rapid test will be a very important tool to enable our land border crossing to be facilitated. So, but again, like many things we do at the AU and Africa CDC, it is a consultation. We'll consult with countries, come to a consensus, and then hopefully begin to use that as a tool to unlock our movement across borders there. But again, we are not yet there, just a process that is that is underway.
Thank you. We have a question that's coming in from Sarah Jerving. But before I give that question, I just want to remind colleagues of the WhatsApp number that they can use to send their questions in to us. And that WhatsApp number is +251 9455 02310. So let's go to Sarah Jerving's question. And Sarah says, I have been told that the containers that Pfizer sends vaccines in can be used as temporary cold chain storage in settings where cold chain systems are under pressure, but must be re-iced with dry ice every 5 days. But I have been told that there are challenges around access to dry ice. Can you discuss this challenge?
Yeah, the Pfizer vaccine, which requires -70 and -80, in my view, it has been, the communication around the challenges have been exaggerated. If you gave us Africa CDC the Pfizer vaccines today, we'll be able to work with countries within weeks to get them prepared if we are properly resourced. So that vaccine it requires storage, and it requires that we also use new tools that are out there or systems. UPS, for example, has systems that -70 and 80s that you can actually hand carry them to remote areas and store those vaccines in it. So I think there's been innovation that has come in. So you don't need to be carrying the -80, the gigantic -80s that we see in laboratories into remote areas. There are ways that you can actually store them up to about 300 doses of vaccines in their stand-up -70s, and then aliquot some of them into smaller -70s and carry them to remote areas and vaccinate there. So I don't think it is very difficult to roll out the Pfizer vaccines. If you give us the Pfizer vaccines, what we'll do is that we'll start using them in major cities like Addis Ababa, Nairobi, and others, and then slowly move them into the regions there. So the issue of dry ice, some countries would have no problem with dry ice, some will have problem. But what I'm saying is that there are tools out there that you can actually get at the same time to support the rollout of that. But you need to know when the vaccines are coming, so that you can plan appropriately. The challenge we've had on the continent is the unpredictability of knowing when the vaccines will arrive so that you can plan properly. So there is no effective program that is run on ad hoc basis. You really have to know with clarity when vaccines will come so that when they come in, you can you develop the appropriate cold chain and roll them out effectively.
Thank you very much. If we stick with the question of vaccines, we have a question here on the most common side effects that people get after the COVID-19 vaccine.
You get at least 3 common side effects. One is headaches or second fever, and then just pain around the area where you get the vaccine. See, if you got it in your right arm, you may be tender for a while. But those side effects usually will go away within the 1 day or 2 days. And that is very obvious, it's documented. Also expect that when you get your second dose of the vaccine, those signs or symptoms may actually be a little bit more severe because what is going on in your body is that your first dose was a prime. It kind of wake up your immune system. And then the second dose was the booster. So the more your immune system reacts to that, there is what you call inflammation happens. And then inflammatory reactions happen, and then you get a kind of a fever and a headache there. So you are not really sick. It's just that your immune system is reacting adequately to the vaccine, which is what the right thing that should be happening. If you got a vaccine and you absolutely had no symptoms and nothing, it perhaps means that the vaccine is not doing what it's supposed to do. So I think it's a good thing that you get a slight fever, slight sense of feeling unwell, but it fades away after 1 day or 2 days.
All right, we have a question coming in from Bonisile Makubu from the Times of Eswatini. So Bonisile says, what are the characteristics of the 4th wave? And what are the chances that it will quickly spread from Tunisia to other African countries?
The 4th wave also doesn't spread from one country to another. It is what is already in the country. Because remember, what we are doing now is to use public health measures to maintain the virus, suppress the suppression of the virus. But what this virus does is that it is, of course, difficult to maintain it, suppress it and maintain it at that level there. So once you start easing the lockdown measures, like movement of people and others, the virus, of course, comes up. And what is very characteristic of this wave is that your wave 3 is, the peak of your wave 3 is normally higher than the peak of your wave 2 and is more severe than the previous wave. I think that is something that is characteristic of all pandemics, and it's also the situation and with this current COVID-19 pandemic. So in other words, it's not because the 4th wave is in Tunisia that it will now spread across the continent. It is within the same country that you see these same waves happening.
Bonisile has written in a second question, and she says, have the vaccines that we are using so far been deemed effective for other waves beyond the 3rd wave?
Oh, yes. I mean, if we were able to vaccinate at speed and at scale, then of course the waves will go away. That is as simple as that. And then the other thing to note about vaccine, and that is why we have a common strategy for the continent that we should immunize at least 60% of our population, is that no country is an island. So we have to vaccinate in a given country and make sure that the neighbors and the entire continent and the sub-regions are all vaccinated. That's when we have the chance of winning the battle there, because we know the variant. If you recall where we started with these variants, very few countries were reporting the alpha, beta, and variant. But you see where we are now, where almost 50% of the countries have this or that variant. So that suggests to us that unless and until we vaccinate at scale and at speed, we'll continue to see these variants emerge. And we truly don't know what the challenge that the variants will pose to the ability to deploy vaccines more effectively there. So it is not a question of if a vaccine will be effective against the next wave. It is a question of how can we roll out vaccination at speed so that we don't even need to deal with a subsequent wave at all.
Thank you very much, John. Let's now call in Esther Nakazi, who wants to ask a question live on air. Good morning, Esther.
Good morning. Thank you very much, Wayne. Thank you very much, Dr. John. We in Uganda are having a very hard time right now. We do not have oxygen and the virus is at its peak. But my question is, Pfizer, the countries that got the Pfizer vaccine had a rough time initially to get their papers straight. Is there an effort right now as they roll out more Pfizer vaccines in Africa to ease the requirements for them to get this vaccine? Because most countries are lacking vaccines, but it was very difficult to get the Pfizer vaccine into the country. First of all, the logistics, but also the conditions that were tied to it. Thank you.
Thank you, Esther. And we are observing the situation in Uganda with very closely and with a lot of concern. And that, and again, it sends a message to the entire continent that they should really adhere to the new strategy that we embrace as a continent on the 8th of May, which is enhanced prevention, enhanced monitoring, and enhanced treatment. And if I start with enhanced treatment, if you recall, we issued a communique really encouraging countries and partners to really stock up with oxygen, because it is that point, that vulnerable point, that if you do not have it and you caught up in the situation like we saw in India, as we are seeing in Uganda, it becomes difficult to get to catch up there. So I think that is clear. And we really, again, continue to repeat and ask for all of your help that countries should use this enhanced strategy that we all endorse on the 8th of May. Now, coming back to your question on the Pfizer, we are working as a collective at the level, continental level, to with these donations that I indicated earlier from the US administration. We have a series of meetings last week with them, and we'll continue to work with them so that we can address collectively some of the challenges that you mentioned with respect to the regulatory components there. But we also ask member states that they work with us tightly, because when we set up the African Regulatory Advisory Group, it was exactly to address the challenge that you mentioned, so that countries do not have to deal with these companies one-on-one. They deal with the companies through us, through the Africa CDC, which is a part of the African Union, to address those challenges there. So we continue to work hard so that we address those challenges. That way, when the vaccines are available, they can easily be rolled out in the countries. You touch on the second aspect, which is the distribution and the logistics of that, and which, of course, if you know, we have the African Vaccine Delivery Alliance, which we meet regularly to discuss those issues and develop strategies to support countries there. So that's a very good question, but we also ask that you support us in that by moving countries away so that they can all adhere to what we've come together and develop as a common strategy for a regulatory approval for these vaccines.
Thank you very much, John. Let's welcome Gabrielle Steinhauser. Gabrielle, good morning. Just remind us of your news agency again and then ask your question.
Hi, Gabrielle Steinhauser from the Wall Street Journal. It's actually a follow-up to this. So in January, I think President Ramaphosa announced that the African Union actually had reached a deal with Pfizer to buy vaccines directly. But my understanding is now that that deal was never concluded. And I'm trying to get a better understanding of why that is, because it's not like the AU has enough vaccines right now to reach the 60% target, right? Even with the donations, even with COVAX, and even with the J&J vaccines that have been procured. So why were the negotiations with Pfizer so difficult, lengthy, and finally unsuccessful?
No, thank you. That is, Gabriela, a very good question, which when President Ramaphosa announced that it was based on agreements that had been reached with several companies. And if you also recall, I'll just add that in that same agreement, if you remember, it was the AZ, there is the AstraZeneca vaccines were part of that. And I think what I've learned in this process, and again, I'm a public health expert, not a businessman and negotiator, but we have the great fortune that we work with people like Mr. Strive Masiwa and President of the Africa Exim Bank, President Orama, and it's a negotiation. So what happened in January is that there was agreement that Pfizer will commit up to 50 million doses of vaccines through the AVAC process, and AstraZeneca as well. As you go through the process, there's agreement and there's contracts. Then you begin to sign the contracts and for that. So we didn't actually, we got the agreements that was announced, and then in the process leading to contracting didn't really happen because of availability of doses at that time. So I think that is what happened. So again, the key here is moving from agreements to signing the contracts. And there are several reasons that will happen there, because the companies will come in with a set of stringent requirements. It's a negotiation between two groups of lawyers, and that, is way above my understanding. And then subsequently they get to really signing the paperwork there. So I think that's what happened. So, but the most important thing is that we were aiming to get 220 million doses of vaccine, 270 million doses of vaccines. If you recall at that time, now we have about 400 million vaccines from Johnson & Johnson, 220 million with an option of getting an additional 180 million. So I think we are still good to go. Now, with the donations that are coming, the Pfizer vaccines, we are in discussions with the US government and also in discussions with Pfizer. So that door has not been closed there at all, because we are open to all options for vaccines for the continent.
Thank you very much.
Let me follow up very briefly.
Sorry, Gabrielle.
Can I quickly follow up just very briefly?
One question, please. Yes, go ahead.
So during those negotiations on the actual contract, what was the main sticking point? Was it price, or was it the issue of the liability?
Well, it's both. It's both price, liability, indemnification, and a series of other things. Now, who has the right to do what, and who doesn't have the right to do what? Like some companies would not necessarily Pfizer. We've been discussing with so many companies. They'll tell you, we actually need to determine where our vaccine goes to. And we actually need to know exactly with specific one, which is very difficult to get. And we are not the only group that have gone through such difficult discussions. I think COVAX and WHO, they've all gone through those challenges there. So it's a very lengthy process and slow process. So that is what happened. It's nothing that we just try to do our best to disclose whatever information we have as quickly as possible.
Thank you very much. We have someone here called Edward Blamo, and Edward says he's working with